Hi everyone, it's Beth Sager with the Lex Local, and today I am here with Daniela Toro of Lexington Orthodontics.
Hello.
Welcome.
Hi,
Hello.
Beth.
Hi. So I understand you're new to this particular business. Tell me about your
Yes,
business.
I bought the practice in March of 2024 from Dr. Tracy Patterson. She
Okay.
was working here for more than 15 years.
Wow.
She had to retire a little bit early. She was a really close friend of mine. I live in Lexington. I'm a Lexington resident. I raised my kids in town. So it was a great opportunity for me to take over the practice. And yes, we've been growing the business and seeing amazing patients since March of this year.
Nice. What did you do prior to this?
Yeah, so I have another office in Burlington. It's called Burlington Orthodontics.
Okay.
And I've been practicing for more than 15 years over there.
Oh,
And this
okay.
is my second location. So yes,
Wow.
I always used to teach at Boston University as well, and I give conferences. So
You're busy.
Yes, and I have 3 kids, so yes,
Okay.
busy.
So how do you decide you want to be an orthodontist? Are you like in dental school and you say, oh, and I want to keep going? Like, what does
Not
that
really.
look like?
No,
Okay.
it doesn't happen this often, but I knew I wanted to become an orthodontist when I was like 9 years old.
Oh, really?
I did, and I went to dental school to become an orthodontist because I was the path to become an orthodontist. It was from really early on. My orthodontist was a mom of a friend, and I liked that career for a woman and a mother. And she ran a really great practice, and she inspired me. And I worked really hard because I knew that getting into orthodontic residency, especially in the States, was very difficult. So yes, I worked really hard to be able to achieve it. But I was very young when I decided to become an orthodontist.
Wow. Yeah, that is super young. That's
Yes.
very interesting.
Yeah.
So then I know you're from Venezuela originally.
Yes.
Did you go to school there or?
I went to school in Venezuela, and then
Okay.
I came to the States, and I did my orthodontic residency at Boston University.
Oh.
And I went back to dental school to get my DMD degree. And then I was board certified, and I was teaching at BU at Boston University. So
Okay.
yes,
All
I
right.
had to go to dental school twice.
Oh, I was going to say, so how many years? Like,
12 years.
wow.
Yes, of dental school. Yep.
That's a long time.
Yeah, but I would do it all over again if you ask
Really?
me. I do. It's really
So that's
my passion.
after college?
Well, but for us, we go directly from high school to dental school in Venezuela. There's no college before, so that saved me some years. But that was straight dental those years.
I see.
So yes.
All right. And what's your favorite part about the job?
The interaction with the patients. I love connecting with people. I'm an extrovert and I love connecting. So getting to know them and their parents, and yes, seeing them grow when they're kids or adults, having adult conversations, that's the part I enjoy the most. And honestly, I work also orthodontically with airways and breathing, and it makes me so happy to improve people's lives with orthodontics. It's not only straight teeth, but we work with ear, nose, and throat, myofunctional therapies. My practice is more than just braces and aligners. And yes, I'm very proud of that. And I speak about that topic in conferences. So that makes me very happy to see the changes on the patients when they can start breathing better and their teeth are fitting better. So yeah.
So it's a function of their teeth, but
the way they breathe affects how their jaws grow, and that affects the position of the teeth. So if we just fix the teeth without addressing the cause that contributed for the malocclusion or why the jaws are not the right size, then it's not as stable. So yes, everything is connected.
So is it mostly kids you see, or?
I would say that it's around 65-35, kids 65 and 35% adults. But adults nowadays want to do orthodontic treatment more than before, and we offer remote monitoring. So it's amazing. The patients have to come less to the office because we monitor them weekly with some scopes that we give them to send us scans. So yes, remote monitoring has really opened a huge window of opportunity for adult patients. And yes, custom appliances are pretty cool. We do braces that are actually custom. They're 3D printed for each patient, so they don't fit anyone else's. They are just made for a tooth to move a certain way. So treatment is faster because it's more predictable. So custom braces or custom aligners like Invisalign makes treatment be more efficient and faster and more appealing for adults. So,
Like, how long do most people have their braces on for?
Nowadays, I would say like a year and a half.
Okay.
It's a good time frame.
Yeah.
Sometimes when we are doing more, it obviously can be give or take. There's patients that do 2 phases of treatment. Kids that are really young, the new guidelines really recommend kids to be seen by age 7.
Oh.
So if they're not breathing well and they're not growing well, we work with ear, nose, and throats. We start growing their palate with palatal expanders, and they do a short phase 1 to do some growth modification, and then we let some years pass, and then we do a phase 2 where the braces or the liners go on. So I mean, that year and a half of treatment is mostly for phase 2, but we sometimes do a early phase, a limited phase to modify growth early in kids. So that's something additional.
All right, and the dentist would probably tell you. I remember the dentist when my son was like young. They were like, "Oh, he's gonna need to see the orthodontist." Like, I think he was like 4, and they were already
yes. No, and the good thing is that now dentists are aware that the guidelines have changed. Now, really, the guidelines from the American Association of Orthodontics is every child should see an orthodontist by age 7.
Wow.
Before, we were seeing them pre-teens when a few baby teeth were left. I mean, I'm sure your son was like that. Now the guideline is by age 7, so that's so important. Yes.
Okay. Yeah. All right. What else do you think everyone should know?
What everyone should know? Well, I love what I do, and I hope it shows. My team is incredible, and they love what they do, and I hope it shows. And we're so happy to be here in Lexington, serving my community, my hometown. And yes, I cannot wait to welcome you here into our Lexington Ortho family.
Awesome. Yeah. Thank you.
You're welcome.
Thanks for your time.
Of course.